advice and tips from seasoned pros and experts to help you improve your business. I'm Karl Barham with Transfer Business Advisor, and my co-host is Rico Figliolini with Mighty Rockets Digital Marketing and the publisher of the Peachtree Corners magazine. Today, Rico is going to be engineer. So I just want to say, Rico, say hi out there to everyone.
Hey guys, nice to be here.
Excellent. Today we have, I want to start off by introducing our sponsor, Hargrave Fiber. When business people, business owners out there need another option to get high-speed internet, cable services, Hargrave Fiber is a great company here in the community that can help provide all your business needs. If you want that personal service, support, an organization that's really involved in the community, Hargrave Fiber is a partner in the community here. We just want to thank them for being sponsors of the Capitalist Age, as well as all of the Peachtree Corners Life family of podcasts. Today, I'd like to introduce a panelist of guests to talk about healthcare options for small business owners and individuals that may not work for large corporations. There's a ton of options out there, and as we come up to the deadline for open enrollment in the healthcare marketplace, we just thought it'd be great to have a conversation on what some of these options are and what different business owners, individuals can consider to make sure that their families, themselves, and their employees have good health insurance options. This year, more than any other in the recent past, has been a very important topic for people dealing with COVID-19 and all other sorts of healthcare options. So first, I'd like to introduce Jennifer Barbosa. She's Empoweress, and the owner and founder of Barbosa Benefit and Financial Services. Hi, Jennifer. How are you doing today?
Good, thank you, Karl. How are you?
Good. And we also have Michael GIglio, owner of Alliant Life, an insurance solution provider that helps individuals and business owners. Hey, Mike, how you doing?
Great. Hello, Karl. Hello, Jennifer.
Well, I want to thank you both. And this is a really great topic, and I want to jump right in and maybe talk a little bit about how do people get into this line of work and a little bit what brought you to that. So, Jennifer, why don't you start off, and then, Michael, you can introduce yourself and a little bit about your company and what you do. Jennifer?
Thank you so much, Karl. Hi, Mike. So my name is Jennifer Barbosa. I am a licensed life and health insurance agent. I've been in the industry for over 10 years and started my career in Washington, D.C., serving federal and government employees, providing life insurance. I often did lunch and learns to teach them about their benefits and how to plan for retirement, and empowering them in knowledge and understanding their benefit packages, especially involving life insurance. From there, I progressed. I became an AFLAC agent servicing the federal DC government as their AFLAC representative. That was over 33,000 employees that I served, and added AFLAC and other health insurance plans to my book of business products. And then I progressed into serving businesses and developing benefit packages for business owners to provide over to their employees and show them how to maximize their plans that are available to transfer over those to their employees to little cost. A lot of employers don't realize how affordable offering a benefit package can be, and as well as taking advantage of those benefits for themselves as a business owner. And that's where I'm at now. And so we talk about the different what's going on in the marketplace with the open enrollment, how that impacts individuals as well as business owners.
Great, thank you. Mike, how about yourself?
Oh, thank you. So I'm retired military. In 2013, I had to make a decision when I retired what the heck I wanted to be when I grew up. So I have family and insurance, so it was a very simple transition for me. So I'm an independent agent, working life, disability, long-term care. And in 2014, started focusing more time on the health insurance side of the business. Focused initially on individuals, both inside of the ACA, Obamacare plans, and in the non-ACA options, but saw a tremendous growing need for options in the group space. So I've been doing a lot of work in some of the more innovative products that you'll find these days, serving small business owners and their employees.
Thank you for those introductions. So I'd like to start off kind of thinking high level. What are some of the options for business owners and individuals when it comes to healthcare insurance? And why is it important that they allocate time, money, resources to make sure that they have coverage? What are some of the things you know people have dealt with that they may not be thinking about?
Well, I think for a business, I think most business owners don't understand why we offer benefits. And benefits were designed for businesses really as a employee retention tool. And there are different rules that have changed over time. Businesses are, if you have less than 50 employees, you're not obligated to offer any benefits at all. So a lot of business owners think, well, I don't have to offer it, so I'm not going to. But if you look at what the cost may be in employee retention, what it will cost you to lose an employee and try to replace them, it may be, and why you're losing your employees, why you're losing staff, that may be something to take in consideration. And oftentimes it's benefits, it's the medical benefits. Employees will move from one employer to another and even take a pay cut over a benefit package. To get those benefits. So employers need to really take that into consideration and ask themselves what that is. And as far as cost, there are so many different plans that are available that you can make available to your employees that aren't necessarily astronomically expensive. And what we do is we sit down with the employers, look at the demographic of their employees, and look at what options are available. Maybe the employer doesn't have any insurance for themselves, which is often the case, and not realize that if they make health plans available to their employees, they can also take advantage of those as well. And you can also break out, you can kind of segment different types of plans. You can make plans that are more robust, available to managers and the owner, and then have a more limited plan available to the rest of the staff, depending on what their pay wage is. So that you're not, I'm sorry?
No, I said I'm curious for this year and in 2020 with the impact of COVID-19 and how it's impacted people's health in various ways. I'm curious, Michael, if you've seen an increase in awareness of the disease and what options do people have before open enrollment to get insurance after they got sick after the fact? How does that transition?
So when we talk in terms of the marketplace and open enrollment, you're generally focusing in the individual space. And it's really important for people to keep in mind that generally speaking, the nation has an opportunity to consider the individual marketplace now. There's a set period of time. It's called open enrollment, starts 1 November, ends 15 December. And that's where everyone has an opportunity to assess whether or not they want to join a major medical plan. What some folks may not realize is one of the benefits of an Affordable Care Act, Obamacare plan is it's a regulated major medical plan. It has to cover essential benefits. Those benefits are comprehensive and expansive. It also allows you to join a plan without having to worry about pre-existing condition limitations that can exist in other non-traditional products. And one of the key features that folks need to keep in mind is there's a thing called an advanced premium tax credit that people may be eligible for if they go into the marketplace, and it can significantly discount an individual or a family premium. So it's a product. I think Jennifer mentioned before we went online, there are lots of options. And part of our job is working with individuals and employees and employers to see which mix of options best serves their specific need. In terms of COVID-19, so here's the big challenge as we've all had to come wrestle with COVID-19. Isolation, separation creates a number of stressors and tension and anxieties, unemployment, just lots of uncertainty, which can really increase the need for mental health care and those related services. It's really important to understand what plans offer those services and what plans don't, because there is a family of plans that don't serve mental health care very well. So those are the things that Jennifer and I, in our conversations with people, will try and better understand their specific needs and how those different options serve those specific needs.
So if I could ask a question about the Obamacare, you mentioned that it's government regulated and it offers certain benefits at it might be a higher premium. What are some of the critical things that someone should consider if they're considering that when they're considering going into the public option?
Well, I think the first thing you should, when I talk to an individual looking into health plans, first you need to know what your pre-existing health conditions are, and you need to know what your budget is. Also, what a lot of individuals do not know are the differences in regards to between a deductible, a copay, a maximum out-of-pocket, co-insurance. All of those are information definitions that you must be very clear about before making a final decision. If you don't understand those, then you're not going to be well equipped to decide on what plan makes most sense, because it has to make sense for your health as well as your budget. And those are things that need to be taken into consideration.
So you mentioned a couple of terms, Michael. I like if you could help us understand, besides the premium you pay, Jennifer mentioned a couple of other different potential costs. What's the difference between a copay and a deductible? What are some of those differences?
Sure. So let's start from the basics. Let's start with the deductible. The deductible is your out-of-pocket costs that you're obligated to pay before the plan will cost share and assist with certain benefits, with a couple of exceptions. Preventive care is provided at the cost of the premium, so you don't have to worry about reaching your deductible. That annual wellness checkup, labs, if you're due for a colonoscopy or mammogram, if you're eligible age, those things are covered as part of the premium. If you have a copay, that copay cost is something you'll pay up front for. But for most of your other care, you're going to have to pay out of pocket the deductible, above which a couple of things may happen. If you don't have coinsurance, then you don't have to worry about cost sharing a coinsurance portion of the remaining bill. If you do have coinsurance, let's say it's a 50-50 coinsurance, and you've met your deductible, costs above that aren't copay related are going to be paid 50% by the carrier and 50% by you. You'll continue out of pocket until you reach your maximum out-of-pocket cost, above which the carrier will pick up the remainder of your costs for that particular healthcare need.
I'm curious, Jennifer, if as he was describing all these costs, it sounds very expensive. to go through all of those options. What are some of the types of plans, starting from what might be the most expensive options to things that might offer a much lower cost option? Just to get a sense, what does that look like for someone trying to make that decision?
Well, there's no, right now, I don't think there's going to be a one size fits all. And you have to figure out what makes most sense for you. If you have pre-existing conditions that require visitations to a specialist, or the likelihood of having an emergency room or hospitalization is greater than it would be for someone else that may not have pre-existing conditions, then you want to take in consideration what your deductible out-of-pocket expenses may be first, because that's when those factors are going to come into play if you become hospitalized, or if you have an emergency room visit, or if you have a specialist. So your premium may be higher if you don't want to have a large deductible. If you're pretty healthy, you don't have any pre-existing conditions, you don't anticipate any hospitalization, barring any unexpected accidents or illnesses, then you may look at a high deductible plan with a lower premium. But again, a lot of people don't take
What is a high deductible plan? Just what is that?
High deductible plan means that you are responsible for the first anywhere from $2,000 or more out of pocket in your bill. And then, so you would be first responsible to pay that first amount from your medical bill. Then you may have a co-insurance. It could be anywhere from 10, 20, 30, 40, 50%. So once you meet that deductible first, you would then share the remainder of the bill, which would be your co-insurance, with the insurance company. Once you've met your maximum out of pocket, whatever that may be, then the insurance company would be responsible for the balance, regardless of what amount that may be.
Michael, I've heard about these things like HSAs, saving accounts. How does that play into decisions? Can anyone get an HSA? How is it used? Is it something that you recommend for folks?
Sure. So an HSA, a health savings account, has to be connected to a high deductible health plan. And on the marketplace, those plans are clearly identified. They meet federal requirements with respect to the cost share aspects of that plan, the total cost that an individual would be expected to incur, and they're clearly identified. And those plans, you can take out an HSA, and that HSA allows you to contribute tax-deductible dollars into that plan each year. Those dollars accumulate over time. It's your dollars. You don't lose it. They stay with you as long as you keep that HSA open. And as long as you apply those dollars to healthcare expenses, it's tax deferred. So it's a really wonderful feature for folks that are looking to apply dollars that provide them a tax advantage towards their healthcare. Hey, one of the things we haven't touched on that's really important about the marketplace, these are HMOs. The vast majority are HMOs, particularly in the Atlanta metro area. You can go into more rural areas, and some of those providers offer PPOs, but the vast majority of plans are going to be HMOs. If you go into one of these plans and you have a pre-existing condition and you have a specific set of providers you want to go to, it's really important that you make sure those providers are in your HMO. They're very network centric. You can't leave the network and expect to get the same reimbursement, same deductible, same access to plan benefits out of networks. So you got to be really careful about that.
You mentioned a couple of terms, and maybe Jennifer, you could help me. I heard PPO, PP something O, and HMO. What's the difference between those?
Well, they're actually they've kind of grown. So there's HMOs, PPOs, EPOs. HMOs are and Michael, help me with the the terminology, but HMOs are closed networks, meaning that you have a list of doctors. Your insurance company will provide you a list of doctors, physicians, hospitals, healthcare providers that you are allowed to utilize in that network that will keep you in that cost of your health plan. If you go outside of it, sometimes you may need to get permission, or you will be responsible to pay 100% out of pocket, or they will only cover up to a certain amount. A PPO gives you a larger, a more extensive network. You have more options. You may not need a referral to see someone if you need to go to a specialist. And then an EPO is similar to that. It's almost like a hybrid per se. Kaiser would be considered like an HMO. They're very close. Everyone, they're very specific with who those doctors are. They have their own specific network. You can't go outside of it.
I want to come back to the marketplace in a minute, but I want to talk about who should consider seeking insurance options outside of the marketplace. What do some of those look like? And if you could just describe some categories and specific ones that people might do and why people tend to choose them.
That's a great question. So generally speaking, I'm very conservative. So when you leave the marketplace, you're leaving all of those federally mandated essential benefits, which means you're not getting the same robust coverage benefits, right? So I generally start with the marketplace as a place to highlight all the things that are available to you through your health plan. The next question, to Jennifer's earlier point, are there pre-existing conditions with specific healthcare needs that frankly you can't have well served outside the marketplace? So that's a good reason to think long and hard about leaving that as an option. And then of course, price. A lot of folks find themselves wrestling with the cost of care in the marketplace if they're not eligible for an advanced premium tax credit. So we'll spend time helping them understand, are they eligible for the tax credit? How does that eligibility work over the course of the year if their income changes? So there's a lot of things you need to walk through to help folks understand, is the marketplace where I need to be? If I can't afford it, am I eligible for a tax credit? How do I apply it? How does that change if my income changes? If it turns out that it's not affordable and I don't have a pre-existing condition that causes me concern for leaving the market, then you've got a number of options that often pulls people out of the marketplace, largely because of affordability.
Got it. So what does it look like to go with a plan outside of the market? What are some of the things people might be giving up so they could help make an informed, especially for solopreneurs, individuals that might work for themselves, but are relatively healthy?
Well, definitely you are giving up the option of having coverage for pre-existing conditions. A lot of plans outside of the marketplace offer a waiting period or elimination period where you have to be with their plan or within that specific plan for a minimum amount of time before those pre-existing conditions are covered. So essentially you're covered, everything else is covered except the pre-existing conditions, whatever they may be. And they may be specific to certain pre-existing conditions as well. Things that you may realize are unavailable or come at a cost can be if you are a smoker. Something as simple as being a smoker, as common as that may be, that can become a cost or make you ineligible for certain plans as well. If you are planning a family, planning to have children, some plans do not cover maternity. So that's also something to be very well aware of, because you do not want to have something that's not going to cover the maternity visits and childbirth as well.
Got it. Can you name maybe specific plans that people are? I've heard some names Michael, can you tell me a little bit about specific ones and just why
Sure.
people may do them?
Sure. So I would generally describe the non-marketplace Obamacare plans in three specific categories. Healthcare sharing program, cost sharing programs like Medishare is a name that many people have heard of. Short-term medical plans are another product that many carriers offer, and fixed indemnity or limited benefit plans kind of round out the three general categories of non-ACA options. In general, they share many similarities: pre-existing condition, limitations and exclusions, limitations on accessing prescription drug benefits. They often don't cover many, if any, preventive care services. So they limit access to certain benefits. And frankly, for many people, that's okay. And it's the savings associated with limiting benefits that's very enticing. So if you're healthy, you're not looking at starting a new family, you're not on any expensive prescription medications, those plans can be a viable option for you. However, they're very different in very noticeable ways, right? Yes. Some are faith-based, and you have to sign a statement of faith and be part of a community that you're interested in sharing healthcare costs, and they're not insurance. They're handled very differently in the context of how they operate.
Can I ask a question about that
Sure.
one?
Sure.
So the example of a faith-based insurance, if I was playing a sport and I got an injury and I had to go into a doctor, what does that look like? How is that different than what people might be familiar with if they work for a corporation? They show their insurance card and somebody gets a bill at some point. What is it like to go through a health experience with like something like Medishare?
Sure. So all of the let me generally categorize them as healthcare sharing, cost sharing programs. They're not insurance. You've joined with a community of people who have agreed to live by a certain set of lifestyle choices and priorities. In the case of faith-based, there's a statement of faith. Because on the faith-based sharing side, there are moral and biblical guidelines to participating in those plans, so they won't cover certain things. But for now, because we can get kind of wrapped up about what they do and don't do, let's set that aside for a moment. Your healthcare experience, generally speaking, falls down one of two paths. Some of these programs have contracted with a PPO network. You get a card, you present that card, and it has the feel of a health insurance experience. So as long as that medical need is covered, is eligible for reimbursement, you can use that service through the PPO provider, the network provider, and it'll feel like a regular health insurance experience. There's another group that are purely cash pay. They don't contract with a network. One of the reasons why they choose not to contract with a network, you're purchasing something, the cost is being passed on to you, so any plan with a network is going to be a little bit more expensive. So one of their cost-saving strategies is, hey, even in healthcare, everybody takes cash. So the least expensive way, frankly, to access healthcare is to be a cash pay patient. So there are some of those healthcare cost sharing programs that are optimized around heavy discounts focused on cash pay, which does two things. You get a cash rate, which is nice. But the nice thing about not being in a network, you're not in a network. You can go anywhere. So you have total freedom of choice.
Got it. Jennifer, I'm wondering, besides that, what other options are there out there for someone that might need some healthcare, especially, in this period right now where people might be facing over the next 6 to 12 months healthcare issues? What are some of the other options they have besides the share base?
Well, there are limited health plans and short-term medical plans, and those vary. And they can vary from plans that only cover medical doctor's visits, which would be your wellness visits, and then other visits. Maybe you might have access to a specialist. It'll cover up to an urgent care visit for emergencies. Anything further than that, you are responsible 100% for those out-of-pocket costs. So emergency room visits, hospitalizations, those would not be covered. In that case, you want to combine that with a catastrophic health plan that is specifically only for catastrophic events, emergency room visits, hospitalizations. Um, so that combination may be a good idea for you. It may not be, or one or the other may be preferable. You may choose to pay for if you consider yourself very healthy and you just want to have something in case of a major medical emergency, you may only want a catastrophic health plan and choose to pay out of pocket for your doctor visits, which can be negotiated with your physician as well. I think a lot of people don't realize that medical bills can be negotiated, and you can discuss that with the medical biller. There are companies who are in service now who become very popular where they will negotiate medical expenses and review medical bills on your behalf and renegotiate them for you as well.
So I'm curious about, a typical small business owner. When I chat with small business owners, they're trying to figure this out. They may have options where different members of their family have different needs. How do you suggest people approach where one family member is higher risk, other family members might be lower risk? Is it economical to mix and match plans, children on one, mother on another, father on another? Is that something that you see people trying to do, patch together for cost savings and get the right coverage for the right situation?
I think it's possible, but I always, my recommendation is first, let's look at the family member that would require the most medical attention or have the most medically costly because of pre-existing conditions. And I would operate off of that. Whoever would be the most susceptible to require the most medical attention. Because if there is a true emergency, what will keep you in the hospital is that medical bill. So you want to make sure that you have a realistic expectation and understanding on what those costs may be and work from there. If you have multiple, two-parent household, and maybe one parent can go have one child, or the children, because it doesn't. Most plans don't have a cost difference if it's multiple children. That may be a consideration, but again, the health plan decision is very case by case centered. That's how I treat it with my clients, and I'm sure Michael does as well. There's no one size fits all, and I don't think anyone will ever be fully satisfied with their health plan. You're going to give up something for something else.
So here's one of the interesting changes that I suspect many small businesses aren't aware of that could be an interesting opportunity for them. So there's a product called an individual coverage health reimbursement arrangement. Mm-hmm. And it kind of addresses this question, Karl, of what do you do if you have an employee group that has a really diverse mix, but you can't afford a traditional health plan? Well, you can actually leverage that product, and this is going to be. So I'm gonna qualify this with this is very different. Okay, there are a ton of small business owners that can't afford to offer anything. So in the world of you have options that are non-traditional, that are different. If you want to examine them, this is one of those potential solutions. You have a mix of employees. You may have some that have a pre-existing condition and they have to be in a major medical plan, but the employer cannot afford a major medical plan, can't do it. So you can offer to all of them access to this individual coverage, health reimbursement arrangement, and the individuals that have a pre-existing condition that requires a major medical plan, he can set up or she can set up a reimbursement amount each month to help with the premium on that policy, and that person can be taken care of. Outside of that, there are a number of healthcare cost-sharing programs that are incredibly affordable and offer access to care, and they through a couple of really innovative solutions. There are a ton of direct primary care providers out there that have pulled themselves out of insurance to reduce costs. Those employees get access to concierge care in ways that most employees don't. The cost savings of that healthcare cost-sharing program wraps around that and offers an extremely affordable option. So whereas the employer may not have been able to provide anything because he has or she has employees that have to be in an expensive major medical plan, you have the ability to segment part of those employees out to take advantage of that and then offer another alternative that addresses the other employees' needs. It's very different. It's relatively new, but for those employers that are looking to provide something, it offers them a unique opportunity.
And it also is a good tax write-off opportunity for the business owner. And it keeps things fair for all employees where, you know, you're allotting a certain amount to everyone, how they choose to utilize it. And it has to be utilized towards health. It can't be for anything outside of health related plans, but it gives people more flexibility. It can alleviate some financial burdens on some employees, and it could make opportunities available for others as well.
I think you're both highlighting something really important that's coming out of this conversation today. Before 2020, a lot of employers had employees, especially small business owners, and didn't feel the need to offer health care to drive that retention, Jennifer, that you started talking about. But if nothing else happened this year, 2020, this topic of health has come center to mind for people. And for those that were impacted by it, I know business owners who lost key employees for a few days or a week, they were recovering from this. And this gap of not having insurance left a lot of people, I think going forward, when people are looking at jobs, I think healthcare packages and options with an employer is going to matter more than they did in 2019. You can't unremember what just happened. And so what you just described as options for people to consider offering their employees that could be more affordable but yet fair, sounds like something that every business owner should be not only just considering going into 2021, but budgeting for. Because, you know, every year businesses make decisions on where to spend more dollars. Marketing, it might be on hiring, recruiting, it might be investing in equipment. But if I'm taking away one thing from this, investing in benefits, and in particular healthcare being an important one, might be one of the best things that a business owner can do to really drive their business into the future, which, you know, at the end of the day, depends on people. If you don't have people at the grocery stores, there's a lot of businesses that struggled to keep up because they couldn't get employees in over the past few months. And if healthcare could help drive that thinking a little bit differently, I think that could be helpful.
Karl, one of the things that I think I see, I'd be curious what Jennifer thinks. You know, health insurance is complicated. People don't like having to grapple with it, quite frankly. And you can get stuck into a status quo and not changing. the truth is, just like everything in business, you've got to want to be, you've got to want to experiment and explore options. Otherwise, you're likely going to find yourself stuck in an expensive product and not happy with it. You've really got to kind of push your comfort level a little bit and examine the new options and alternatives that are out there. Otherwise, the risk is you're going to pay more than you should for what may not be the best coverage anyway.
That's very true. Whether you're an individual or a business owner, investing the time to look at what is available and what is going to make most sense for you or your business is well worth the investment than it would be the cost in the end. And I think a lot of business owners feel like they just want a Band-Aid, a one size fits all, and how quickly can I get this over with, as opposed to really taking the time to look at what those options are, what your individual business operation is, your employees, what their needs are, because you have to take in consideration of the needs of your employees if you want to keep them around, unless you like spending time and money replacing employees, which will definitely cost you more, and take more of your time away as well. So those are things that a business owner should definitely take in consideration. You got to buckle down, sit down with a trusted agent who's going to go over the different options, review them, and tell you the truth, and understand what the pros and cons are, what things do and what it does not do. I always tell my clients is I'm going to go over, and I might spend more time on what it does not do, so that you can be very clear about your options. And when you make your final decision, you are very clear about what you're giving up in that decision over what it is that you're gaining on it as well, because you don't want to make a decision and come back later on wondering or having had these assumptions and finding out that no, that's not what it does, or no, that's not what it costs, or no, that's not even eligible, and it's too late.
I have one last question on the marketplace. Every year, the insurance companies that participate seem to change, or some state is saying some change. Anything for Georgia, folks in the Atlanta metro area and Georgia in general, any big changes in the plans there that folks should take a look at, or you think would be notable to take a look at?
I didn't see anything. I mean, there's not as many options, not as many carriers. A lot of carriers pulled out within the last few years. There are some new health insurance companies that are in play now that we have not heard of before. I think if my thought process is, if they made it into the marketplace, then they meet the minimum requirements that the government has put into place for the Affordable Care Act. At that point, you want to look at what those costs are going to be for you, what the deductibles are, your premiums, your out-of-pocket expenses. And then if you have physicians that you see regularly and you're not willing to make any changes, then I would first call your doctors, ask them what networks they're in, so that before you make your final decision, you know that you're working off of the networks that your physicians are within.
Got it. What about you, Michael?
Yeah, no, I absolutely agree with Jennifer. The marketplace is regulated, so to enter the marketplace, your plans have to cover those essential benefits. And it becomes a question of premium versus deductible versus max out of pocket and networks.
Well, I tell you, we could have a conversation about this and dive into different aspects for quite a long time. And I might tap you to dive deeper into specific topics from time to time, because I think it's complicated and people are scared of complicated things. And it's just easier to say, I don't want to deal with that. I don't want to think about it. But when a crisis like this year happens, it rises the importance of wrestling through and figuring out, not just for your family, but for your employees, for making your business more competitive, that people can get good health care when they need it. Um, but I'd like to ask, how can people reach you, Jennifer, if they had more questions and wanted to dive into these topics more? What's the best way to reach you?
Well, I'm easily accessible via email at jennifer@barbosabenefits.com. You can reach me personally on my cell phone. The number is 202-643-0018. Shoot me a text message, call me, or send me an email. I will definitely follow up with you immediately if I can't answer the phone right away as soon as I get an opportunity. I'm more than happy to answer all the questions that you have. I think it's really, really important that you're well informed before you make any decision, especially when it involves your health and your finances. So I'm more than happy to assist.
Awesome. Michael, how about yourself? How can people get in touch with you? What's the best way?
But sir, they can, again, by email, reach out to me at mike@Alliant Life, ALLIANT or at my cell, 770-715-4493.
Well, again, I want to thank you both, Michael from Alliant Life and Jennifer from Barbosa Benefits and Financial Services. We just started scratching the surface of what the options are, both in the marketplace and outside around healthcare. And if I were to say, when people are thinking about budgets for 2020, if you go into the marketplace and you see a plan that might cost $800 or $900 or maybe $1,000, and you look over 2021, 12 months, $12,000, that might be a good investment with all the things that are going around for both, not only yourself, your family, your employees, to make that investment. So if people do need it, they have access and they're not questioning whether they should go in to get help when they need it. We want people to be safe as possible, and it might be time for folks to reconsider their options or explore them more fully. And again, I didn't realize how many options outside of the marketplace there is, depending on your situation. So definitely reach out to experts in the field and see if there's things that could help them. I want to thank everybody for joining us today. Again, Hardgrade Fiber, our sponsor, has been a great supporter in the community, helping people, especially over the past year with internet access, cable, here in the local community, being a good supporter of businesses and the community in general. We want to thank them for continuing to sponsor the family of podcasts, including the Capital Stage. And Rico, how are you doing? And you have anything coming up?
We just put our last issue to bed, Peachtree Corners magazine, so it's going to hit the post office tomorrow and be in mailboxes by the end of the week. 19,900 homes will be getting that magazine, and we're going to start publishing most of it online in the next few days also. So all good. It's Faces of Peachtree Corners. We highlighted 20 different people in the community, students, leaders. It'll be a good issue. Hopefully everyone can enjoy it.
Excellent. And I'm Karl Barham with Transworld Business Advisors of Atlanta Peachtree. Our business is helping business owners figure out how to improve their business. And one of the things that I'm passionate about is sharing information with business owners so they can increase the value of their business. And one of it is by retaining people, keeping your best people, and all the things you can do to make sure that happens. So if you're looking to improve, grow, or exit your business, you can contact and schedule a consult. I can be reached at kbarham@tworld.com, or you can visit our website at www.tworld.com/Atlanta Peachtree. Rico, how do people reach you if they want to connect with you?
Sure. With the magazine, they could go to livinginpeachtreecorners.com and find out a bit more about what's going on in the magazine and in Peachtree Corners. If they want to reach me for anything dealing with social media, online content, videography, photography, just go to mightyrockets.com, or they can call me if they like at 678-358-7858. So.
Well, again, I want to thank Michael and Jennifer today, and stay tuned for more episodes of the Capitalist Sage podcast. It'll be available on Facebook, YouTube, and your favorite streaming apps. Thank you. Have a great day.
Take care.